Welcome to the first episode of our Care Area Knowledge Series. If there's one thing that has changed in the recent years, it's healthcare. We are right now seeing an explosion of digital, many advances towards precision health. As individuals and patients, also, we are a lot more informed. However, healthcare can be very complex. And as individuals, do we really understand our own heart? That's the big question that we are going to be answering in today's session. I have with me Dr. Shravan Subramanyam, Managing Director of Wipro Healthcare, to take this conversation forward. If we look around today, what we see is that heart diseases can be a silent killer. What do you think? Where is this gap?
This has been around for a long time, and as our population has been aging over the years, our life expectancy at birth has about doubled in the last 75 years since independence. As we're going, we've been tackling different diseases for different age groups. Typically, diseases of childhood, could be infectious diseases or other physical or genetic anomalies. And then as people grow, it could be accidents and then disorders related to diabetes and so on. Right? But we've been solving for each of these through preventive means, through vaccinations, through other safety means, public health interventions. And as a course of that, naturally, the population has been aging. And cardiovascular disease has come into prominence now because this typically happens as people age. But it is by no means exclusive to aging populations, right? It could happen at any age, and we should be very careful about this. Long before the pandemic crippled our healthcare systems, we were already reeling under the epidemic of cardiovascular diseases. And in India alone, we account for about 17.5 million deaths through cardiovascular diseases. So anything, it could be an arrhythmia, it could be cardiac injury. These are very prevalent heart complications. And this is something that we need to worry about, especially in the context of COVID-19. It's not just this, the vulnerable population also is very much at risk depending on disease profiles, lifestyles, and so on. So I'll pause here. The point is, this is a very critical disease. We need to know this better. We need to have the right facilities. We need to have the right solutions, the training, the clinical measurements, all of that to deal with cardiovascular disease.
Right. That leads me to my next question, Shravan. Everybody, the first resort of information today is the internet. That said, the biggest gap still remains. Are we really aware of what do we need to do when it comes to heart care? And what are the big steps that you as a medical doctor would suggest to build a community which is more aware and which is more informed with the right information?
Yeah, that last sentence is the most important, Shipra. It is the right information because we have a ton of information being thrown at us on a daily basis. Anybody who has a smartwatch can now get an ECG done literally at the push of a button. And people who are going for their health checkups, they're getting tons of information. Of course, you go to the Googles of the world, you're getting information. What do you do with all this information? And here you have to think about how a disease evolves, right? We need to think about preventive measures. How can we prevent if we don't have the right data? So you need screening technologies, you need risk stratification, diagnostic tools, monitoring tools, treatment tools, and so on. So for us, we need to understand our heart, we need to understand our family, and the journey to effective healthcare starts with awareness. And alongside with that, of course, technological advancements on all sides. We need a roadmap. We need to think differently. We need to make the right decisions. It's not just an individual. You need to involve your family, your community, your healthcare provider. The entire ecosystem needs to come together. If we're talking, since we use the term epidemic, it really affects our entire population, and everybody has a role to play. So we need to think about healthcare access. How do we access the right healthcare at the right time?
Right. That's very interesting, Dr. Shravan, because what I'm hearing is whether it is heart care or any other disease, information at the click of a button is one single instance of information that one can get. However, taking care of yourself in a more holistic way really requires analysis of a lot of data, analysis of a lot of trends, patterns, and putting all of it together in context, and then study that, and then that is what leads to more personalized care pathways. So that's something to think about. Taking care of your heart can be very complex, and most people, including me, we don't really understand these terminologies, heart care terminologies properly. For instance, can an average patient distinguish between cardiac arrest and a heart failure, and how are they different?
Shipra, this is a good question. And of course, I would invite the audience to turn to their clinicians for very specific details and avoid Dr. Google unless absolutely necessary. But some quick definitions. Heart failure is basically when the heart muscle is not pumping enough blood, right? So blood will get backed up and then the fluid gets congested in the lungs or in your extremities like the legs. So this will cause shortness of breath, swelling of legs and feet, and so on. Cardiac arrest is an abrupt loss of heart function. Okay, and this could be accompanied with difficulty in breathing, loss of consciousness, and this has to do with the heart's electrical system, which disrupts pumping. And another term which you often hear about is a heart attack, myocardial infarction. This is when one or more areas of the heart muscle is not getting enough oxygen, right? So when this could be when the blood flow, it's ischemic because blood flow is blocked and that part of the heart muscle gets blocked. Other terms you might come across like cardiomyopathy, it's a disease of the heart muscle, which makes it difficult for the heart to pump. So there are a lot. All these definitions, of course, can be found online, but don't make a decision based on that. Please connect with your physician and talk to them about what might be affecting you, your family, based on your history, and think about what you can do next.
Heart can be very complicated, but there are ways and means to maintain it. And while taking care of your heart, use your heart to take care of your heart. Again, just inviting your reactions to when we talk about awareness about taking care of your heart. What are your views on the theme of this World Heart Day? Use heart for every heart.
I would say, Shukra, this is an opportunity for us to collaborate as a larger ecosystem. It could be collaboration between industry players to develop best-in-class treatment mechanisms. It could be between service providers and medtech providers to create end-to-end cardiac centers. Academia has a role to play in developing new solutions. And ultimately, we want to create access to the best technology, the best treatment methodologies to make it available to patients, right? So it could be like, for example, interventional cardiology. This is a very important tool that is required for diagnostic procedures of the heart. There might be some other tools for screening procedures. And there might be some, once you have a diagnosis, what do you do next? So, for example, GE Healthcare has a partnership with Boston Scientific to link a couple of different steps in the patient journey. And there could be partnerships with other say pharmaceutical companies, for example, to see how we can get the best and most precise care. We want to deliver precision care to the patient. The government has a role to play because screening has an important attribute when it comes to cardiac care management. And the best screening programs are public health driven, where either the government alone or in partnership with private players, they come together and develop these mass screening programs, which then allow us to risk stratify a large population and then help individual patients.
Talking about Dr. Google, I think all of us, every single person on planet Earth, is half doctor by passion or information. But considering this is a knowledge session, Shravan, and you're a medical doctor, are there any tips that you'd like to give to our audiences on how they can take care of their heart?
Yeah, there's a danger of being half a doctor because you don't know which half is right and which half is wrong. But I'll give you some general tips, not just as a doctor, but sort of what we might have read and what we learn from people around us. Number one is eating healthy, right? You are what you eat. And then if you are able to get active, staying physically active also helps you very much. Stay at a healthy weight, measure your body mass index, and try to stay close to the right BMI for your age. And of course, you know, there are other things also like smoking, alcohol consumption. All of these are also factors that affect your heart health. You've got to look at your other, parameters like your blood cholesterol, your blood pressure. So it's not just any one of these. Stress, managing your stress. So it's not any one of these, just eating healthy or getting active or managing your weight. It's all of these that need to come together. It's very difficult, I know, for everybody to do all of this all at once. But at least if you start with knowing what these are, and then think about how you can assimilate this into your life, Shubhra.
So when I look back to everything that you just said, Shravan, it's everything that our moms tell us. So if we can just stick to the mother's prescription, I believe we'll be home.
Pretty much. But the idea is, the heart is very much around us, right? So take care of your heart, take care of your family's heart, your community. A lot of cardiac disease, Shipra, is preventable. We just need to apply our minds to making sure that we take care of our hearts.
Thank you very much. It was a very, very good conversation. I hope everyone enjoyed this discussion as much as I did. Stay tuned for more of these discussions at the Heart of Care. Thank you.